Now I want to welcome our final speakers. Steve Bittle is with us, and he spoke from the University of Ottawa. He spoke for the last 2 years about some of his Canadian research around suicide, and now we welcome his new international research colleague, Sarah Waters, who's going to share some information about their new study and the reason for it and what they're planning. So, and then hopefully we can hear about it next year as it progresses. So Sarah's a professor of French studies at the University of Leeds, and her research focuses on work-related suicide in France and cross-nationally. Her recent book on this subject, Suicide Voices, Labor Trauma in France, was published in 2020. She campaigns in the UK and internationally for reform on the issue of work-related suicide and for safer workplaces. So welcome, Sarah. And I'm going to share Sarah's slides, which I realize now I haven't done in a while oh, that's the wrong PowerPoint. So we need this one, and we need to
That's it.
Do it from a presentation perspective. How's that? Is that the open slide? Great.
Perfect. Can you see me, Val, or do I need to do anything?
Yeah, we can see you, and people can change their own view about whether, if they want to see just the slides or the person or whatever. But yeah, I'll turn off my, well, maybe I'll turn off my video so I'm not distracting, and just let me know when you want me to advance the slides.
That's great. Thank you so much, Val. Yes, so in my presentation, I wanted to talk about this new research project on work-related suicide. It's a 4-year project funded by the Wellcome Trust in the UK. We're very much in the early stages of the project. So rather than presenting research findings, I wanted to tell you about the particular approach we are taking to the complex issue of work-related suicide, why we are taking this approach, and why we think it's really important. So we're a team of 4 researchers based in 3 countries, in the UK, France, and Canada. We will be recruiting a research assistant in each of those countries in due course. We're a cross-disciplinary team. So 2 of our researchers have a legal background. Steve Bittle, who Val just talked about, who presented in this forum last year, who's a specialist in criminology and corporate crime. Our French researcher, Loïc Lerouge, who's a specialist in occupational law. China and myself are qualitative suicide researchers. So we are very much focused on the individual lived experience, on qualitative research, on looking at individual cases as opposed to more quantitative macro data approaches. China is based in a community-based organization in London that tackles racial and social injustice. I forgot to just say at the beginning that this presentation will be focused directly on suicide. This is a difficult and sensitive subject. It may be triggering for some of you, so please do take care of yourselves and do feel free to leave the webinar at any point should you feel the need to. We brought together this particular team because we are interested in deepening our understanding of both the causes and contexts of suicide. The causes. We'll undertake an in-depth analysis of individual suicide cases. We'll examine all of the documents linked to those cases. We'll undertake interviews with family members and with bereaved colleagues. But we're also interested in the context of suicide. For each suicide case, we look at the legal and regulatory context. We'll ask, was the suicide officially recognised? Was it investigated within a health and safety framework? Was it recorded as a work-related death? what were the experience of bereaved families? What legal redress did they have in the aftermath of the suicide death of their loved one? So just to move on to the next slide and to give some context to this issue, if I could have the next slide, please, Val.
Just having some difficulty advancing the slide. Let me just see if I do. Oh, here, let me go to the next page. How about that? No, that's looking at the videos, not looking at the, sorry. Trying every button, it's not working. Let me just escape. No, it won't let me do that. Okay. I'm going to stop sharing and share a different way. Okay, and I will share it on my screen instead of in the app. See if that helps. So, still not advancing. Oh, something else is advancing. Okay. Escape from that and see. So what are you seeing now? You're seeing the slide with the notes. You're seeing that?
Yeah.
Okay, so then how can I advance that? For some reason, okay, so here's the image. And
yeah. Maybe go back into slides.
Pardon me, which slide?
Sorry, no, that's absolutely fine. But if you click on slideshow at the top.
Yeah, I'm going to see if it will. Okay. No, went back to the wrong one. Ah. Tony, any ideas?
So maybe just use the arrow keys or spacebar?
That's what I've been using, the arrow keys, and they're not doing anything. But when I'm in slideshow, let me try the spacebar. Sorry, everybody. I should have, no, that's what I did wrong. Sorry, I didn't do from current slide. Ah. This is, okay, from current slide. Well, that was the, okay. I had to click directly on the slide with my mouse. Okay, I'll try that, but it, okay.
Perfect. Oh, that worked.
No, I'm still back. I'm going to try and doing it from the current slide. Okay, at least we got that. Okay.
Thanks, Val. Tech is always meant to try us. These things happen. Okay, so work-related suicide, what is the scale of the problem? Recent studies, approximately 70,000 people die by work-related suicide globally each year. These are cases where the suicide is linked to factors of work, whether structural conditions such as pay, workload, hours, relationships, so issues linked to bullying or discrimination, or other work-related experiences. In our changing global economy, precarious employment, digitalization, and work intensification place an unprecedented toll on our mental health. There are more people at work with mental health conditions than ever before, and at a far greater rate than physical health conditions. Next slide, please. We know that working age adults have the highest rate of suicide compared with any other age group. Many of them are in full-time or part-time employment at the time of their death. Although employment is a protective factor in relation to suicide, most suicides occur amongst people of working age. In the UK, the highest suicide rates in 2023 were amongst male adults aged between 40 and 49. Suicide is also the leading cause of death for adults under the age of 50. Next slide, please. So just to give an overview of the evidence, as I mentioned, studies now show that 10 to 13% of all suicides are estimated to be work-related. We know that there are sharp differences in suicide rates across occupations, and this is a pattern repeated across most countries with similar economies. So for men, the highest rates are in the lower skilled occupations and in particular construction. For women, it is the caring occupations such as health and care which have the highest suicide rates. In the UK, teaching is also a sector with high suicide risk. And if I've time, I'll talk briefly about a particular suicide case in the UK involving a teacher, and which illustrates some of the issues that are at the centre of this project. So we know that a person's vulnerability to suicide is shaped along social, racial and gender lines. And these factors interact with mental health to influence suicidality. We very much see suicide as a multi-dimensional part of people's lives. It's something that is shaped not only by material conditions of work, but also the way that work influences aspects such as social belonging, collective identity, connectedness. Next slide, please. So as Faraz mentioned, this is an under-researched area. However, there is a growing body of research evidence that is pointing to the links between suicide and work. So work-related causes or stressors, including work overload, irregular and long working hours, bullying, exposure to violence or trauma, work inspections, sickness absence, or poor mental health awareness amongst managers are some of the factors that come across in the literature. Next slide, please. Yeah, so this is a really difficult area to undertake research on. There are very many challenges. One of the key challenges is that in a majority of countries worldwide, work-related suicides are still legally unrecognised and undocumented. They remain socially invisible. Only a handful of countries systematically collect data on work-related suicide. Yet we know that data collection is a cornerstone of effective suicide prevention. It allows an otherwise hidden or unclassifiable social problem to become a visible issue and a terrain for policy intervention. So the lack of social visibility and the poor data collection means that suicide prevention is rare and inconsistent. This is an under-researched field. In suicide research, mental illness explanations prevail, and they tend to focus on individual psychology and pathology. They often overlook the impact of wider social or structural factors. I think Bedin referred to them as environmental factors. The lack of legal recognition and the lack of accountability means that bereaved families often experience a profound sense of injustice following the suicide death of a loved one. Next slide, please. Did you skip a slide? Oh, no, you didn't. Sorry. It's me who skipped a slide. Sorry, yeah. So our project is underpinned by a social justice vision. We believe that to understand and prevent suicide, we need to consider the full range of social, economic and structural factors affecting the individual. We need to move beyond a narrow and linear framing in terms of mental health alone. We see suicide as a matter of collective social justice that concerns the policies, the laws, the structures that shape the shared conditions of all our working lives. It's a question of ensuring safe working conditions for all people. It's a case of ensuring that work doesn't cause harm or cause a risk to life. Because of the prevalence of mental health and medicalized approaches to suicide, strategies for addressing this problem in the workplace often rely on therapeutic approaches rooted in psychological concepts of wellness, resilience, and mindfulness that tend to focus on the individual rather than the organization as a locus for change. Such approaches, while very, very valuable, often fail to address structural aspects of work, and in particular, the impact of working conditions in causing the psychological distress that may lead to suicide. So I'll go to the next slide, please. Thank you, Val. So we're taking a comparative international approach. We want to draw on comparative knowledge. We've selected these 3 countries because they share a similar globalized and digitalized labor model. They face similar challenges in the sphere of work, but each one of them has a sharply contrasting system for managing workplace suicide and mental health. So in France, for instance, work-related suicide is legally recognized in legislation, in workplace regulation. Data is collected centrally on work-related suicides. In the UK and Canada, work-related suicide is not officially recognized. It is excluded from health and safety frameworks. Canada is unique in that occupational health is managed at provincial rather than national level. So this provides a particular government type for workplace mental health. And in Canada, where Steve Bittle will be leading the research, we'll be focusing initially on Ontario, where Steve has already done research on this subject. But we then plan to extend to 3 other provinces, Quebec, Alberta, and British Columbia. Next slide, please. So what exactly is our research plan? What are we planning to do? We will undertake in-depth qualitative analysis of 150 individual suicide cases based on a methodology of post-mortem sociological autopsy. This means that we will examine, we will review every single document, every single piece of information that is linked to that individual suicide case. We will undertake widespread interviews with bereaved family members, with colleagues, with professional representatives. We will also deepen our understanding of work-related suicide by talking to people with lived experience, those who have experienced suicide attempts and those who have experienced bereavement. So that's one part of the analysis that will be undertaken by myself and China Mills. The second part is very much focused on a comparative socio-legal analysis of policy frameworks across the 3 countries so that we can compare policies, laws and regulations relevant to workplace mental health across the 3 countries so that we can identify good practice and also be able to shine a spotlight on gaps in regulatory provision and legal protection. We'll collaborate closely with policymakers and community partners so that we can produce genuine co-produced findings. A key aim of this project is to produce a first evidence-based framework that we'll bring to policymakers at national and international level, that we'll discuss with them so that we can hopefully make a real impact on policy, on suicide prevention at national and international level. I'll move on to the final slide. Yeah, so behind the suicide statistics, behind the suicide data, their lives, very traumatic individual stories, human stories. And I'm just going to talk briefly about a very high profile case that took place recently in the UK, and that really highlights all of the issues that we're trying to raise about the importance of seeing suicide not only as a mental health issue, but as a matter of collective social justice. So this particular case involved the suicide of a head teacher in a primary school who tragically took her own life in January 2023 following a school inspection at her school by Ofsted. Ofsted in the UK, in England, is the body that undertakes school inspections. In England, the school inspection system is notoriously cruel. It's notoriously high stakes. The outcome of an inspection, if it is unfavourable, can really determine the career of the head teacher in that school. It can have effects on the local community. It can affect, house prices in a local community. It's a real high stakes, knife edge process. If a school receives an inadequate report, a head teacher can lose their job. The school can be taken over by a private academy. So all this by means of saying that the pressure on a head teacher is extreme. This is a case of, very intense work-related pressure. There is no grounds for appeal if the outcome is unfavourable. That you just have to live with the outcome. So what happened in this particular case? The school had previously had an outstanding report. It was an excellent school. The school was managed by a very dedicated, outstanding teacher. And because there was an error in the paperwork, some of the background checks in relation to one of the teachers in the school weren't available, weren't on file. The school was given an inadequate rating, which of course created, extreme stress and distress for the head teacher. The head teacher was also instructed to keep the outcome of the inspection confidential, to not talk about it to family or friends until the report was produced, which again exacerbated the stress and the distress which was being experienced. So huge injustice for this teacher, for this teacher's family, but also systemic issues because all head teachers experience a similar inspection system. Because in the UK, work-related suicides aren't recognised officially, there was no inspection following health and safety inspection following the suicide. The suicide wasn't recorded as a work-related death. No measures were put in place because of the particular regime in place in the UK. Injustice for teachers, also injustice for bereaved families. In the inquest that followed this case, and this is very typical, the family was faced with very powerful organisations with large legal teams funded by the taxpayer, so Ofsted and the Department of Education. The family, even though this was a case of overwhelming public interest, was denied legal aid and had to raise funds through a crowdfunding initiative on the internet. So injustice also in relation to the huge imbalance of power and the lack of legal redress for families. So this is just one example of many where social justice is central to understanding the suicide case, and where the stakes go beyond the individual and affect entire communities, in fact, affect an entire sector of teachers. So social justice is at the centre of our research project, and we aim to use our research findings to generate recommendations which will hopefully produce reform in policy, in occupational health policy, in suicide prevention. And what we want to do is to make a case for safer workplaces and for the importance of putting systems in place to prevent further suicides from occurring. I'll stop there. Thank you very much.
I'm talking and you can't hear me. I just want to say thank you very much for the information about the study and for sharing Ruth's story. It does give it meaning and context, I think, because there are so many individual impacts, and as you say, this one very clearly has community impacts as well. Because I've been sharing, I haven't been able to see the questions, but I will go look at them. Tony has posted the Slido, which is just a few questions just to ask you whether you learned anything and might share it with others, which we would appreciate you completing. If it didn't come up on your screen, it'll be in a little S at the bottom beside the chat and the people attending. I did have a question that came to mind actually before I go look for the others around. So France being part of the EU, I guess, is that policy unique to France when you say that it's recognized, or is that an EU policy? And then are there prevention efforts that have already started as a result of the recognition and the recognition of the patterns and risk factors, shall we say? Would you say that there's a prevention progress in those countries already that we might hope to emulate or bring to the other two countries in the study?
Yes, thank you very much. It's a very good question. It is specific to France. So France is one of a handful of countries where work-related suicide has recognition within legislation. And France is a very important country. You may have seen there was recently a landmark case in relation to the company France Telecom, where there has been a breakthrough in legislation in that this is the first company where managers have been held criminally responsible for a wave of suicides that took place in that company and have been given criminal sentences because of the particular legal framework that allowed that to take place. And so France really stands apart in Europe, but also in the world in relation to this issue, I'd say.
Okay, thanks. That's interesting. Because I was wondering too whether there's parallels. It's good because Quebec is further advanced, not necessarily in terms of suicide. Maybe Steve would know that, but in terms of workplace mental health, it emulates the EU in that there's a legislation that says you have to do some kind of, you have to have a program and you have to evaluate that program every few years, like they do in the EU, which is not a requirement in the rest of Canada. And so I don't know if there are any parallels in Quebec, Steve, if you know that in terms of suicide recognition. Oh, can you unmute? I think I have to request you to unmute. Now you can unmute.
Perfect. There, I couldn't unmute. No, short answer is no. That I don't know that there's parallels between Quebec and France at this point to the level of specificity that you've discussed for sure.
Okay. Thanks. So I'm just catching up on the questions, and people can put up their hands and unmute if you want to do that as well. And now I've lost my my way out. And if anyone else sees any questions that they so there was some reference earlier to Aidin that I'd around the CSA standard, and that was the health and safety standard, not the psychological health and safety standard that was being quoted. So maybe we can talk about that in a minute. But I wanted to just make sure, were there any questions or comments for Sarah or Steve about their presentation? There's one here from Tom from QP saying, if there's only 10% of self-harm events are reported, what do you recommend as best practices for both prevention and reporting of work-related self-harm events? So that could be for either of you, but Sarah, do you have any? I guess so. That's not necessarily all the way to. It's expanding to recognizing self-harm as well as suicide. Is that a part of the prevention? But how does one frame that? I don't know. Any examples?
Yeah, I think that's very interesting. I think certainly incidents of self-harm have even less. There's less chance of them having any form of official recognition. And just to put this into context, in the UK, if a worker, an employee breaks their arm at work, or if there is a case where an employee has asthma as a result of working conditions, the employer is legally obliged to report that as a work-related incident, accident. Suicide is excluded in all circumstances. It's very much still perceived as an individual, private tragedy rather than something that concerns work in the workplace. And precisely what we're trying to do is, given the rise in mental health issues and conditions in the workplace, is to bring suicide within a health and safety framework, to treat it with the same rigor and attention as any other work-related accident or death. And by doing so, to ensure that all workers and employees are protected from suicide risk.
Okay, thanks. Once again, Dorothy, you've posted something else around the hazard of suicide. I haven't had a chance to go look at that. I don't know if anyone has, and has any comment on that. That's in the UK, I guess, of suicide as a hazard. And then Radian, you posted a nurse suicide story from BC, which has parallels, I think. Do you want to add anything about that?
I think the question there, Val, relates to, and Sarah's done work with the Hazards campaign. Sarah, I don't know if you want to speak to that at all.
Sure, I'll speak after that then, Valerie.
Okay, great. Yeah, so, yeah. Do you understand the question, Sarah?
Yeah, so the Hazards campaign is a trade union campaign in the UK, which has really been at the forefront of lobbying to try to bring about change on this issue. And it also produces a magazine, Hazards magazine, and I work closely with them. Steve has worked with them as well. Just to mention Hazards, because they have done such important work in this area, and that this is a research issue, but we also want change. We're really committed to bringing about change because this is such an urgent issue.
Okay, thanks. And the links there and the chat so people can learn more about it as well. Yeah, Baydeen, did you want to talk about the article that you shared?
Sure. I was just saying something that was in the popular press, and it was shared with some of my colleagues here at U of T and the Faculty of Nursing around this nurse who died by suicide in March of 2025 here in Canada. So the examples are only close to home in the healthcare system based on the workload, the issues with that are going on there. And I would say it's well beyond the healthcare system. There's unfortunately stories of this that I've heard in the construction sector and other sectors where this is happening, and we're essentially still treating it as a personal issue and not necessarily something that's needs to look at it through a public health lens. So I think it's well beyond the borders of the countries where I just heard the speakers talk about. It goes globally.
Mm.
Mhm. I've actually known two healthcare professionals in my life who were strong. One is an accident prevention advocate, an emergency physician, who was I met him at a public speaking event, who later, only very shortly later, died by suicide. And which is just so bitterly ironic that he spent his life advocating for injury prevention among youth and among others, and also someone who is a very strong advocate from Alberta, a nurse during COVID, and about the impact in healthcare for that profession, especially, who also took her own life. And those are just me intersecting with a few people professionally, but I think it is a major issue, and so I'm really grateful for you for the work that you are all doing, and trying to identify. I mean, clarifying the lens on the issue, and then on the what was going on at the time, and then how can we go upstream. Well, it's the primary prevention, but also the secondary prevention. How can we get help to people when they need it, so that maybe things can be diverted? How can we recognize cries for help? There's some other things being shared. Monica shared an article. I don't know if you want to comment on that, or and Dorothy. Monica, did you want to comment on the article, or just as something to share with people? And Dorothy, you asked about health and safety agencies and departments reacting to this study. So do you mean Faraz's study, or do you mean the one that's currently underway, or some of the past work in suicide, or what was the reference? Oh, you have to unmute.
No, it was just the study that Sarah's working on and with Steve. I'm just curious about whether it's workers' comp boards or health and safety departments. What if they know about this, and what kind of reactions they're getting when this is brought up? Because it's a difficult subject to talk about, and it's not one that a lot of people may want to recognize as job related.
Yeah, I mean, there is a huge, I don't know what to call it, a battle of interpretation around what suicide means. And I think, certainly from my experience in the UK, we have this health and safety executive that is responsible. It is the UK regulator. It's responsible for preventing work-related deaths, but it prefers to see suicide as individual, as complex, as something that can't possibly be inscribed within a health and safety framework. So there is a kind of battle going on around what suicide means, how it should be tackled, how it should be managed. And I think Steve and I and the other researchers are trying to push the agenda there, and try to and also not to create binaries. It's not about sort of mental health interpretation against the workplace. Often the two overlap. And, people may have mental health issues in the workplace. The workplace still has to ensure that people are protected and that suicide risks are addressed, and that we see suicide in a more holistic way and not in a binary way.
Yeah, that's good. Faraz, I'm not sure if you're still here. I know you had to go at 12:15, which is a moment. I wondered, as Sarah was speaking, whether so you're measuring a broader set of scales in terms of harms and addiction and that kind of thing. I just wondered, is there any difference between something that's recognized as suicide and then these other deaths that are still still can be tied to the workplace and the work experience and the lived experience? Do you have any comment on that, just from a research perspective? Or
curiously enough, I actually think it's a question I have for maybe Sarah and Bettine, who are, I think, a bit closer to the OHS. No, I know are closer to the OHS space than I am. And tell me if I've misunderstood your question, Val, but like my question, actually, I didn't know whether to pose it or not, was going to be, so there's a focus on suicide, but I guess I often do wonder, in general, in the mental health space, how close are we at all to, like, suicide is one example. How close are we to recognizing other, like, mental health related issues as being work related? Is there like a theoretical rationale for focusing on suicide? Is it more practical in terms of the I'm not sure how to characterize, but the gravity of suicide that makes it a useful starting point to have this conversation about occupational etiology of mental health problems? That's kind of what I'm also gathering from your question, Val, but it's actually a question I have. I don't have an answer.
Does anybody else?
I thought Sarah might.
What I would say is that the sort of issues we are facing now with the UK regulator in relation to work-related suicide are the exact same sort of battles and struggles that we had 15 years ago in relation to work-related mental health. So work-related mental health tends to be recognized. There are measures in place. It is far more advanced in terms of health and safety. But there was a battle. They had to lobby. There was there was a lot of work to do to get mental health recognized as a work-related issue. And now, suicide is the battleground, and regulators want to separate it off from mental health and individualize it and pathologize it and, take it out of the health and safety space. Is what I think I'd say.
I'm so sorry that I have to step off, but I guess Steve, I may reach out to you to ask more, because my impression was, aside from severe traumatic and PTSD related injuries and so on, our workers' compensation system is actually not recognizing mental health related injuries and illnesses as having causal sort of roots in work, at least not when it comes to recognizing the compensable nature of those work-related injuries. Again, short of some very narrow, in my view, personal view, I should say, and I'm speaking on my own behalf and not on behalf of my employer, but a rather narrow view of sort of very acute PTSD trauma-related injuries. Any other mental health-related injury, essentially, are not viewed as being even considered for compensation. But I'm so sorry that I have to leave, because I want to learn so much more about this. So I might reach out to you and and Steve separately. But thank you so much for your time. And I feel so rude for stepping off, but I unfortunately have a 12:30, so I do have to go.
Okay, no problem.
Thank you everyone for your time. And thanks, Val, for the invitation again.
Yeah, we really appreciate it. And we'll have a video. You can catch the video that Steve's
Excellent.
answer later. We can tell you whatever minute it is into the video. So
Excellent.
Thanks again for us
Thanks.
for all your work.
Thank you all. Appreciate it.
Yeah. Steve, did you want to add to the discussion?
Just a very general comment that I'm not sure answers Fraz's question adequately, but for me, I do think I agree that his point is that there's a larger issue at play here, of which work-related suicide is a phenomenon of, and that has a lot to do with the nature of work and workplaces in modern society, and how those need to be transformed and changed as well, not just to address this particular issue, but many related issues. Mm-hmm. And for me, I came into this issue. For me, my research background is on work-related fatalities stemming from the Westray disaster and related issues. Mm-hmm. And when you look at many of the factors associated with serious injury and death in the workplace, fatal injury and death in the workplace, I mean, the factors are very similar in many respects about the nature of work and the regulatory environment related to those sorts of issues that dovetail with many of the issues that we're now talking about when it comes to mental health in the workplace and deteriorating mental health in the workplace, leading in some instances to suicide. So somewhere along the line, I think many of these issues come together, and they do raise important questions, for me at least, not only about the nature of work in modern society, but employer accountability for those issues. And I think that's a large issue that often gets left off when we start talking about the regulatory environment and occupational health and safety. Is that at the heart of this, employers have some responsibility for the nature of the workplaces that they create, and it goes far beyond just having workplace mental health initiatives that help improve, that are important and help individual workers. But there's something more structural at play here that I think will come to bear in many of these discussions. Mm-hmm.
May I just add a little bit too, perhaps? On the clinical perspective, no, I agree. I think what's there on the compensation website, at least in Ontario, the Workplace Safety and Insurance Board, is what Faraz and others have said. I agree. I think that makes sense. But I think there certainly are programs, including CAMH's mental health program. That's one of the specialized services. They receive these kinds of referrals, not to say that it's explicitly for suicide, but certainly there are mechanisms and channels. So I don't work for the WSIB, full disclosure, but I don't want to either throw them under the bus in any capacity. But I think that's there are also mechanisms in place, and they are changing the way they're doing these types of assessments through their occupational health assessment program. So I think there are resources, but yes, definitely more work that can be done around this. And the stigma that comes into mental health is there. And I think that's part of some of this that needs to be explored. So, but there are some channels to look at it here in Ontario as well through that CAMH program and among others.
Great, thanks. That's helpful. I was thinking, and I didn't articulate it well when Faraz was here, the deaths of despair concept that he's looking at. So it's beyond something, labeled as a self-harm, but seeing patterns of premature death in occupations, this stress-related, heart, blood pressure, other physiological impacts from chronic stress. I think I was wondering, is there a difference between the pattern and the pattern of suicide? But probably not. They follow each other. So, it's been quite valuable. I think that I don't see any other actual questions. And thanks for the link to CAMH. And very much, Steve, of course, that's what we're here about is about workplace is ideally primary prevention in the workplace, which comes from recognizing the workplace factors that are having an impact, which can be different. That's our survey tool, our stress assess survey tool, which builds on the Copenhagen Psychosocial Questionnaire, but adds more occupational health and safety context, and can be used as a tool in the toolbox of identifying correlations between health impacts and the climate in the workplace, I guess, by virtue, and it can be used iteratively to make some changes, and then a year later see if it shifted things. But it's a technical and sophisticated product, so it's not the solution everywhere. And starting to dialogue and identify patterns and brainstorm solutions within workplaces and recognize, which is what this whole series is about in today's conversation, is the major impact that work has on people's health and lives. And that, as you say, Steve, that employers should be held accountable, and it should be part of running a workplace, that the health and is the fundamental importance of the workplace, is that the health of the people doing the work should be of primary concern for the success of the workplace and the productivity of the work, and for the sustainability of the workplace. So Tony put the Slido in again for anyone who hadn't clicked yet. And I will, at this time, I think we'll wrap up. But I would ask each of the speakers if they have any final comments about the discussion today, or about any other, references or future plans or anything like that. So, Vivian, do you want to go first as the first speaker? Do you have anything else you want to share about today's?
Sure. No, I think, thanks for the invitation to speak today. It's really nice to be able to share some of what we're doing, and also to learn from what's happening not only here in Canada, but beyond our borders too. So I appreciate that. And if there's, if you have any questions related to some of the work that we're doing, I think the Workplace Mental Health Initiative that is part of my research program is very near and dear to my heart. And I'm happy to answer any questions. Please reach out to me. My contact information is in the slides. I'll leave it at that.
Thanks. And I meant to put in the chat that you also presented at our RSI Day, and the link between physical harm and workplace mental health is something that I think we need to also be conscious of in terms of chronic injuries. And so if you visit our RSI Day page on our website, you'll be able to find Vivian's talk from that day.
Thank you.
Okay. Sarah and Steve, I don't know if I think it would be great if you each wanted to share anything in wrap up.
No, I mean, I think I learned a lot from listening to the other two presentations, so that was great for me. And I think particularly the second, Faraz's presentation, there's lots of interesting parallels. So Steve and I might be able to sort of, catch up with him and see if there's overlap in our research interests. And thank you very much, Val, for the invitation. And it's been really, really enjoyable. Thanks.
Great. Thank you very much, too, especially for joining us late in the day, too, for you. I know that. So we appreciate it with the time change to England. It's not that bad, though, 5 hours, I guess. But we do appreciate you taking the time to join us and share. And the leadership of the project. I think it's a really important project. It's great that you got a significant grant from the Wellcome Trust, that they're investing in this knowledge that I think is important. So I hope that we can hear about the progress internationally as well as nationally. So Steve, do you have anything to say?
Just to add my gratitude for the invitation again this year. It was a really informative session, but also we'd love to hear from folks if they want to reach out to us on any ideas or suggestions or that they might have in relation to the project. They should feel free to reach out to us by email or to contact us, and we'd love to hear from you.
Great. Thanks. So now we just shift to, and it's kind of a segue, actually, I thought, in terms of the discussion about how your project will apply to certain provinces, is that next week we're talking about the sort of a cross-Canada conversation about, as you noted, that because health and safety is a provincial provincially mandated, there are different approaches across our country. And we have actually the opening speaker now is going to be from Newfoundland and Labrador, and the closing speaker is from BC. So we're literally going from coast to coast. And we also hope to, unfortunately, our Quebec speaker had to withdraw, but we're hoping to still talk about some of the other provinces in between, which with some other speakers, and also with those of you who are attending, and to understand what's working and what people are trying, and from a regulatory perspective, from a compensation perspective, and from a grassroots and organizational perspective, and also we can learn from each other and try and make things better in our workplaces and our provinces and our country and the world. So there we go. Thanks very much, everyone. Thanks, Tony, for your tech support. And thanks to Lisa Wilder, our communications coordinator, who will be turning this video into a playlist, and we'll be posting the slides. And that should be, the video's on YouTube already. It will render as soon as we turn off the live recording. And then the playlist and the slides will be ready next week. So thanks very much, everybody, and take care, and see you next week. Thanks. Safe travels. Bye-bye.